My name is Nathan Woods, and this is my audience. You ever fallen and hitting your head so hard you feel your brain shift from within? Probably not. But this injury is actually very common in athletes. This is called a concussion. I myself have actually had a concussion from playing several years of football. What I would really like to talk about is the link between numerous concussions and the damage it can have on an individual's brain. First of all, what is a concussion? According to the Sports Concussion Institute, a concussion is typically induced by trauma to the brain, whether it be direct or indirect. This causes several problems that may cause the brain to act differently. There are several different types of symptoms associated with a concussion. First, physical. Physical symptoms are not necessarily the most threatening, but are often very immediate and often intimidating. First of all is a headache. Every concussion is associated with a headache, first off and immediately. Following can be nausea, which is very uncomfortable but also not very threatening. Next, the individual can experience cognitive or thinking impairments, such as difficulty with concentration, confusion about the situation, or the person could be susceptible to memory loss as well. Extreme memory loss is not very common, but at the time, for the next hour or so, it's actually very common. Emotional symptoms may be present. The person may be very irritable. They could be aggressive towards minor issues that could usually not mean anything to them, or they could become depressed for a few days following. Both are very, very possible. Next, and final, is maintenance issues such as sleep disturbances, changes in appetite, and energy levels. Sleep disturbances are actually a fairly big issue because athletes can become insomniacs. They can get very little sleep or have trouble falling asleep, and throughout the day they just have extreme drowsiness and just be very unpredictable. Changes in appetite can also occur. Decrease in hunger throughout the day can make you very sluggish. So how common are these injuries to the head? Concussions are most relevant in athletes more than anyone else. 5 to 10% of all athletes will experience a concussion throughout their career. Football is the most common, with 75% chance of actually getting a concussion in the sport. This is also coming from the Sports Concussion Institute. About 47% of all athletes do not report feeling any symptoms after a concussive blow directly to the head. Concussions are very common in everyday people as well, with about 1.8 to 3.6 million individuals getting concussed every year. And 10% of those victims do not report any kind of immediate symptom at the time of the accident. Possible long-term effects of multiple concussions could be a syndrome called post-concussion syndrome, or PCS. This can include severe depression, a sense of not being yourself or slow, short-term memory loss, attention deficit disorder, or extreme confusion. PCS can lead to symptoms very similar to Parkinson's disease and can lead to partial wasting away of the motor pathways that can lead to significant attention problems. Tests revealed by the Sports Concussion Institute show that older athletes who suffer from concussions experience a thinning of the cortex in the small part of the brain towards the back that have similar effects as Alzheimer's disease. With all this being said, it's quite apparent that concussions are no joke and should be taken very seriously. Now that you're aware of how they are caused, how common they are, and some of the mental damages they can cause. It is very important to be safe when playing any sport, and if concussion is suspected, call a doctor right away. Thank you.